professional practice and advance in their knowledge and education. And I think on this slide, I would probably like to just focus on the last bullet and look at, again, it gets back to the workforce and how you develop and implement strategies that promote the retention of nurses and educators in the workforce in the country. The ICN actually has a statement that nurses as individuals and professionals have an ability to pursue professional advancement, so they don't out and out prohibit migration. People can make individual decisions. So with that in mind, and knowing that there's these forces out there with push and pull and businesses out there trying to recruit nurses, I'd say one of the most powerful messages I can try to give is it's not a panacea, but how as opinion leaders you can work in countries towards constructing environments that are conducive to the profession, recognize the profession, and how to sort of use those factors to promote retention and inclusion. ONS as an organization, we're oncology specific, but we also worry about the nursing shortage. So these are just some of the things we've done. We have a position statement on the nursing shortage. In it, we don't necessarily speak to the prohibition of recruiting foreign nurses, but clearly state that it is not the best solution for addressing the shortage, and that should come from within our country. We've also endorsed a set of principles that were developed by the American Association of Critical Care Nurses that looks at a healthy work environment. So again, how do you construct an environment where nurses want to stay and want to work and they feel that they're a valued part of the team? We advocate for funding for nursing education to bring people into the profession. We hope to serve as a resource for non-oncology nurses that are out there providing cancer care, partnerships with schools of nursing to teach nursing students about oncology. And then what I'll talk a little bit about is the international endeavors to try prioritize sustainable capacity building initiatives in our international work. I'm not going to focus on this slide except to say I think it's been mentioned several times at the conference on the importance of breaking down barriers, both in how professionals think about cancer as well as the public. And I think nurses can serve a very important role here in culturally looking at what those barriers are and trying to educate both their peers and patients and families about the importance of prevention, early detection, trying to make people aware of cancer and get them into the system. Roles of nursing worldwide. The point of this slide that I'd like to make is actually one of the other challenges that you see in the developing world is there is a lack of the ability for nurses to specialize. So as you can tell, we're a specialty nursing association. There are many, many nurses in the United States that consider themselves specialized oncology nurses. But what I've learned over the last several years is that that's not the case for nurses in many parts of the world. So not only do you lack nurses, you lack the education, but they don't always have the same ability through practice and education to specialize as we think about it in the developed world. So they may actually in a hospital be assigned to work in a unit. If they like oncology and they're working there and would like to stay and develop more expertise, they may get moved to another part of the hospital. Now, this doesn't necessarily happen everywhere, but I've heard this from some of my colleagues and peers that that's one of the things, again, in the work environment that doesn't contribute to the specialization of nursing. Just to make the point, this is that nursing, I think it's important that nurses have knowledge about oncology, and they impact all stages of the cancer care continuum. So to talk just a little bit about ONS and representing the profession and the organization, just to say we believe that it's important to be a strong advocate for the skills and the knowledge of nursing, U.S. and worldwide, over 35,000 members dedicated to this specialty. And we believe it's very important to be an international leader to the best as we can with our resources in developing capacity in the different parts of the world. So some of our international goals, a lot of these at the top actually developed when we asked of our members how did they see ONS's role in the international arena. And so one of the first and foremost is it's important to say you learn from your colleagues outside the U.S. And I think it's been incredibly clear here as we've networked and learned that there's a lot that we can learn from one and the other. It's not always a one-way flow of information. That we partner with others in the international arena to achieve those goals and to try to serve the nursing community. But most importantly is to try to do it in a way that builds capacity. It's not just to come in for one time, provide education, and then leave, but how can you think about it differently to sort of enhance the professionalism of the nurses in the region? So that said, to say just a little bit more about some of the programs that we've tried to develop is essentially, with that in mind, looking at how could programs be sustainable and influence change in a region. So we've tried to initiate activities in parts of the world where the needs are clearly identified, and we would have the opportunity to make an impact by hopefully providing the necessary knowledge and ability for the nurses that receive the education to make change in their region. So this is just an example of one of the strategies that we use. In nursing, a lot of times we'll use the expression train the trainer. So in an educational endeavor, you would go in, and the people selected to come to the event would be those leaders in the community, and you would impart the knowledge and then also the ability to carry that knowledge forward to others and train others with what they've learned. So it hopefully makes the nurses feel more comfortable that they then have the knowledge and how they can take that knowledge and make a difference in their community. We've done that with nurse trainers in the Middle East, most specifically with the Breast Cancer Education Project, and that was really the subject of the poster that we had. Some of the programs that we've been that we've had the good opportunity to be involved in was with a partnership with the U.S. Middle East Breast Cancer Awareness and Research Partnership, and these are just 3 of the locations with which we've developed programs. And this was a project also that was involved with the Komen Foundation funding as well through the partnership. It was a training program that was based on our site-specific breast cancer. We have both a publication and an online web course that served as the basis for the course that was put on there. And it was put into modules so it could be flexible, and then those on site that could assess the educational needs and sort of adjust the program to the needs of the participants. I'd like to also say that as a part of this program, we were able also to translate the book into Arabic and French. So this program focused on increasing not only knowledge about breast care, but also teaching nurses how to communicate that information to their colleagues, to empower them to ask questions as they interacted with their peers in the healthcare team, and to be able to advocate for the needs of patients. And then the course provided examples about how people might implement a change in practice. And I think that's very important. Many times in education, we talk about what should be done, and we provide the necessary knowledge, but we don't always give people the knowledge and skills on how do you go about making that change. That's really the hard part in practice. We do have some post-assessment data. It's early, but we're beginning to follow up with the nurses that have attended these programs and get some information back on what have they done with the training. And so many of them, these are some of the things that they've done, but they've shown to help increase communication with the healthcare team, overcoming barriers, and being able to educate other nurses. But ultimately, the long-term goal would be by increasing their capacity and knowledge, you'd have an impact on patient care. So this is just a specific example of some of the follow-up of what some nurses have done. It's small, as I said, it's preliminary, but they are taking what they learned and conducting training, incorporating that information into curriculums, and implementing changes in patient education and so forth. So in conclusion, I think no one here at this meeting denies there's a need for global nursing education. I believe personally, and our organization has taken the stance of it's important in conjunction with that information that we integrate teaching about leadership and advocacy and help nurses see themselves different and as a very vital and important part of the team in making that change. And how do they develop that capacity, and then using the train the trainer model to hopefully have sustainable education in the country. So this is the contact information for ONS. We do have a special mailbox for international initiatives, and again, to acknowledge the staff that has really worked most intensively on this particular program. And then at the end, you'll see on the website there'll be some available references for studies that have actually looked at the issue of shortage and migration. So with that said, I thank you so much for your attention, and I hope you enjoy the